Hello, and welcome to Laying the Foundation for a Customer-Centric Organization, a Peppers & Rogers Group webinar. I'm Liz Glogowski, Executive Editor of Strategy and moderator and speaker for today's event. This is the fourth webinar in our healthcare series, so if you are returning, welcome back. And if you're new, thank you for joining us today. Now, I am joined today by Mark Ruggiano, who is a partner at Peppers & Rogers Group. Mark leads Peppers & Rogers Group's healthcare practice, and he brings a wealth of expertise and cross-industry experience to today's discussion. So before we begin, let's quickly review the ON24 interface. So for a PDF copy of today's slides, please click the green PDF icon button at the bottom center of your screen. We also have another PDF download available, which we'll talk about later in the presentation. If you encounter any issues with the PDF download, please notify us via the purple Contact Us button. We also encourage you to submit a question at any time during the event. You can just click the Q&A button on your screen, type your question, and hit Submit. And we made time at the end for a Q&A section to answer any questions that you may have. And your questions will be discussed anonymously. We will also have a brief survey for you at the end of the program. And there's a list of FAQs to the right of the enlarged slide link if you have any other questions. And of course, submitting a question is always an option. We have our technical team standing by to answer any questions you may have. And additionally, there will be contact information for Mark and Business Development Director Tom Schmazel at the end of the event for any other follow-up. So let's move on to today's agenda. Today, we will begin by setting up the all-too-familiar scene in the healthcare industry. There's a case to be made for creating trusted relationships with consumers, not only for feel-good reasons, but also for financial ones. I'll share some Peppers & Rogers Group research about how relationships can lead to financial impact. Then, Mark will discuss the details of work that we've conducted at a few health insurance clients. There are many opportunities to build relationships and improve operations to be more customer-focused. He will share the strategy behind some of those relationship-building activities. And finally, we will leave time at the end for a question and answer session. And as I mentioned before, you could submit your questions at any time. Okay, so let's begin. So I'll begin talking about the case for trusted relationships. The healthcare industry, particularly the insurance space, is not known for being progressively customer-centric. And the current system is very complex, but it's an ecosystem that is not sustainable. So in this slide, the chart shows that the cost of healthcare in the U.S. is high and continues to rise. And this isn't new news to most of us. You'll notice the U.S. figures are the big tall one all the way on the right. So U.S. investment in health is higher than in any other developed nation. But Americans are not seeing above average results as a result of that spending. This next chart shows the average life expectancy, which is a surrogate for the efficacy of that spend. And you'll notice the U.S., it's well below expectation. We're just not getting the bang for our buck overall when it comes to healthcare spending. Now, add to that the fact that customer experience within the healthcare industry is well below par. Now, this chart measures customer experience by industry. And you'll notice that comparatively, health insurers are all the way at the bottom, below cable companies, airlines, and internet service providers. Now, this is just the reality that the industry is not on the same page as consumers. And overall, the U.S. healthcare system costs more, we're not seeing results, and it fails to deliver an optimal customer experience. Now, there are a number of reasons for this, and it's a complex industry, as we all know. Now, we won't get into the specifics, but looking at it just visually may help tell some of that story. So in this slide, you'll see that there's a visual definition for the word health. Now, the word health can be thought of in numerous ways. You'll see at the bottom that there's a definition of wellness, which is a healthy state of well-being, free from disease. The middle, you'll see, it refers to the general condition of the mind and body. And at the top, it refers to condition or state at a particular time. Now, that's not a very simple definition. And when you add the word care on top of it, it just becomes even more murky. In this representation, care can mean so many different things to so many different people. So it's a complex industry with numerous constituents, and unfortunately, consumers have not always been at the top of that priority list. Now, we at Peppers & Rogers Group think that a consumer focus can provide a real opportunity to improve relationships and the bottom line for health insurers. Now, I'll quickly share with you some research that we've done on the topic. Excuse me. So here's a word cloud that we've developed that can show consumer associations with the term health. Now, they can associate health with many different things. You can see well-being, life, good, physical, exercise, doctors. That's how many consumers consider health. Now, when we ask them about their perceptions of health insurers, that word cloud looks very different. It's not obviously tied to those attributes of health. Many of these terms that you'll see in this word cloud are negative, and they relate to the experiences that consumers have with their health insurer. So you'll see terms that pop out are uncaring, unhelpful, complex, overwhelming, etc. Now, there are a few positive attributes peppered throughout here, but you'll notice that from their size, they are not really strongly associated by consumers. So that's where we are right now. And we ask consumers to describe an ideal health insurer, and this is the cloud that they came up with. Now, you'll notice most of those terms refer back to the experience and also to empathy, not to price and process and procedure. Now, you'll see there's a lot of important terms here, but the one I want to point out is specifically the word trustworthy is notable. Excuse me. Now, an ideal health insurer is one that consumers perceive to be trustworthy, and its actions to build a trusted relationship can have a positive impact in a number of ways, which I will show you right now. So we recently did a study with consumers about trust in the healthcare space, and we found that only 38%, those in green, trust their health insurer to do the right things. On the flip side, 43% in blue actively distrust their health insurance company, and 19% in the gray were neutral or indifferent. So what makes a consumer want to trust their health insurance company? We created this chart to show some examples. Now, the chart shows a number of activities that can impact trust, and you'll see the green line, the green circle line, shows what trusters value in their health insurer to make them feel trusted. So you'll see that they rated terms like effective, helpful, reliable, and up-to-date as most important. Excuse me. So we also broke down the percentages of trusters, distrusters, and neutrals among the top 5 insurance companies. So you'll see, based on these numbers, so trusters are in green, distrusters in blue, and the neutrals are in gray. So you'll see that Anthem has the lowest percentage of trusters in the green, and United Healthcare has the highest percentage of distrusters, which is the blue number, but only by a small margin. However, Kaiser Permanente has the highest percentage of trusters comparatively, though their business model includes doctors and hospitals as well as insurance payers, so that may give them the relationship edge. So what's even more interesting, though, is the opportunity that exists when a company actively builds trust with their consumers. Now, our study found that consumers are willing to pay $29.38 more per month for a health insurer with a high level of trustability or being proactively trustworthy. Now, using each payer's number of customers, this chart represents the revenue potential in billions of improving trust. So how can insurers build trusted relationships and become more customer-centric? That's for Mark Ruggiano to discuss. So right now I'll turn it over to Mark, who will share some examples that Peppers & Rogers Group has done about how to lay such a foundation. So Mark?
Great. Thanks, Liz. And thanks to all of you who are here on the webinar today. It's a pleasure to be able to talk with you and to share some of our experiences that we've accumulated over the last 18 to 24 months in helping a handful of health insurance clients to begin to navigate the transformation to become more customer-centric organizations. This would be great if it was very interactive, and so I'll encourage you to take advantage of the Q&A functionality of the 24 console, and look forward to taking any questions either at the end of this webinar or certainly offline if that's a better forum for it. One of the first things that we face and that we often discuss with health insurers before they even become clients is, really what's the case for making changes. And Liz described, I think, at a macro level, some things that many of you who are in the industry have already recognized, and some of you at least have certainly begun taking action on these things. But anytime you're considering the kind of critical change of direction that this represents for many health insurance organizations, you have to make an airtight case, create a vision, create a compelling picture, and sometimes create a financial impact estimate of what making this change is going to entail and what it will result in. And so what you see on this slide are really three main sources of that compelling case. The change in consumer expectations that are primarily being driven independent of anything else. Those expectations are changing as consumers are being trained by companies like Amazon and Nordstrom to expect different treatment, to expect different value, and to expect to have a different experience with the companies they choose to do business with than they used to have in the past. And those expectations are increasingly coming to bear on the health insurance sector. Competition is the second source. Obviously, competition, whether you're a nonprofit or a for-profit, competition exists and has a tremendous impact on the performance of our businesses. And whether your clients are, or whether our client, has been a national player or a regional player, kind of the changing nature of competition in the industry, is something that they've all felt. So that's the second source of opportunity in making this transformation. And the third is the one that's in the headlines almost daily, changes to regulation and the things that may or already have to be done differently going forward than they have been in the past. So, in some combination, these three sources of change have helped us work with our clients to make the case for transformation. That case is different in almost every situation, but it really draws from these three sources. What I'm going to talk to you about next, over probably the next 15 minutes or so, is a series of snapshots drawn from some of our recent client work. And they're going to highlight 5 or 6 of the key things that we have worked with clients to address. And taken together, these examples really communicate the process of identifying what direction within this range of customer-centric directions, identifying what direction your company needs to go, creating a plan to make that happen, and along the way, getting your customers and your colleagues on board with that journey. So this first one highlights a very common initial step that we take with our clients. Understanding where a particular organization is today, both from an internal perspective as well as from an external perspective, is a critical first step. So, internally it involves things like understanding business strategy, understanding marketing plans, understanding sales plans, understanding capabilities in the customer service organization or in the IT organization, and things like that. And externally, it involves understanding competitors in a particular marketplace. It involves understanding the impact of changing regulations and other things at the state and federal level. And taking all of that together, it gives us and our client a snapshot of where their organization is. And that allows both of us, while we're working together, to really make sure that our efforts and the investments that are necessary are focused on the right places and are delivering the biggest bang for the buck. At the end of an assessment like this, we are often able to categorize different departments within our clients in terms of how customer-centric they are today. And what you see here is an illustration of one such categorization. You can see at the far left a situation that's fairly common. Our client sales organizations are, to this day, very focused on the employer space, and in the next 2 to 4 years, don't envision that focus changing. Certainly not dramatically, and that may, in fact, be the future that we all encounter over that time frame. But our belief is that increased focus, increased customer centricity, even for parts of a health insurer like the sales organizations that deal with large national accounts, for example, will be a beneficial change and will be a competitive advantage. But as I said when we started, this is an illustration of where an organization is beginning this journey, and many times the sales side of the house begins that journey with very much of a product-driven mindset. And you can contrast that with some of the other examples that you see here. In health services, for example, there's typically a much more consumer-centric mindset. And so we work with clients to understand where they are starting this journey and then work with them to create a roadmap, which I'll show you in a few minutes, to carry them forward. The second example that I want to talk about is a market research example. Peppers & Rogers Group believes that a key to success of any transformation such as we're describing here is really clear understanding of what the consumer and other customer types as well, but in this case the consumer thinks, needs, and wants. And this slide gives you an example of how we use market research as a foundation, and more broadly, we use customer insight through data analysis and primary research as a foundation for the strategy setting steps that I'll get into. What you can see here are two insights that you could probably read and would be corroborated from a number of other sources. And so on the left-hand side, you see various versions of kind of the definition of health, and on the right-hand side, you see some examples of motivations to stay healthy. A key differentiator and a key success factor to making market research a foundation upon which these kinds of transformation can be built is conducting this research in a way that it can be attributable and actionable at the individual member level. And that's a very different approach than many market research houses take to this type of project. And we believe that that's a key success factor. So while each of these insights that you see on this slide could probably be found in other sources, being able to tell an organization which of its members believe which of these things is something that our approach enables. And as I said, we believe that that's a key success factor in making a strategy like this actionable. In addition to understanding consumer motivations and needs and other things, we also believe, and this example illustrates, that an ongoing program of collecting and listening to the voice of the customer is an integral part and an important component of a transformation like this. And in this example, we helped a client create an online panel, and we helped them evaluate and investigate a handful of new product opportunities that were in one stage or another of development within the organization. And this type of test and learn approach is something that is commonly taken in online businesses. It's common in a retail and consumer packaged goods environment, and we believe that those kinds of lessons learned, as illustrated by this example, will become more and more critical for health insurers to embrace and to get good at. So armed with those insights, the next couple of examples are going to talk about some key areas of the business that those insights can be brought to bear on, and together those things feed into the transformation roadmap that we'll finish up with. The topic of branding is something that other industries, it's at the top of their conversation list. It's the main headline in their trade publications and other things. In health insurance, that is not the case. Brand has historically been a second or third tier consideration, and that is rapidly changing. And we work with our clients to approach branding in a very different way than a traditional agency does. Our approach to branding is consumer-centric branding, and we believe that a brand is an integral tool in establishing consumer expectations that can make or break the success of your customer experience efforts, and that those three concepts go hand in hand. And what you see here is an illustration of that concept, or of the three concepts that are part of our approach to branding. And on the next slide, you can see that our work with several different clients begins with a fairly traditional task of understanding the current perceptions of a brand. We also look at similar perceptions of the specific client's competition, and oftentimes we do that on a regional basis to capture those differences. And then finally, we combine some of the market research that I discussed previously, in particular the research into consumers' needs and motivations. And those three factors really create the map on which we are able to plot brand opportunity, brand competition, and also plot areas where sort of brand success is unlikely. And in doing that, once again, that map is populated by each individual member or prospective member in some client instances, so that we can talk about the millions or hundreds of thousands of consumers that fit into a particular brand space. And that kind of actionability is once again a critical success factor. So understanding brand is one area that the insights are very useful and valuable in. The second and very tangible one is in the creation of a segmentation so that those insights can be acted on at the individual member level. And so our segmentation approach addresses segmentation from three different perspectives. The first I've already mentioned. In the left-hand side of this slide, you see the needs dimension. Needs are really our term for attitudes and other motivators that cause consumers to do what they do. And the result of that is the behavior dimension in the middle. Those are the observable things that your firm probably observes either in person or through the tools and technology that you make available. It covers things like channel usage, product selection, health service utilization, health system utilization, a variety of other things that really capture all of the behavioral information that you have access to. And then the third dimension is the value dimension, and that's value to the health insurer. So, at its simplest, it's premium less cost of care, and we have many clients that strive to go well beyond that simplistic definition and think a lot more granularly about the value of different subscribers. And taken together, these three dimensions lead to our 3D segmentation. And what I'll show you next is an example of one of the segments. This is a persona that is derived from that member-level research and segmentation that I just described. So, this persona was derived from approximately 200,000 individual instances, individual members that that through the analytical process fell into this segment. And you can see some of the typical persona highlights on the left-hand side, and some of the more detailed needs, behavior, and value information on the right-hand side. And again, I think the unique characteristic here, and an important consideration as you're thinking about your organization and this type of transformation, is the segmentation needs to address all three of those dimensions. Whether you follow Peppers and Rogers Group's methodology or create your own, and it also needs to be actionable at the member level. And so, getting an industry report that says there are 6 segments of people who are likely to be entering the exchange market in 2 years, that's very helpful at one level, but being able to address those people individually in your markets, whether they're prospects or customers, that's what your segmentation efforts should be focused on, and that's what this client example is showing you. So again, armed with that insight, armed with the segmentation that describes the needs, the behaviors, and the value of various groups within your member base or prospect base, what we're able to do with our clients is to map out segment-specific plans to deliver the kind of experience with the kind of efficiency that is appropriate for that segment. And so this slide shows you kind of a before scenario. This is a set of steps from an onboarding process at one of our clients. And you can see the various process steps that are involved. You can see at a high level some of the different systems and how they connect. And you can see as you go clockwise around this page that the process has a number of places where things aren't connected, where there isn't a tool or technology in the mix, et cetera. And so understanding that experience and armed with the insights from the segmentation allows our clients to create segment-specific experiences and map those to changes in process, changes in system, changes in technology, et cetera, that are necessary to deliver it. And this slide shows you the after. You can see an onboarding process that really centers on the enrollment activity. And you can see 12 discrete interactions that are designed to be a part of that onboarding process. And the previous map showed you the before, and obviously the changes that are necessary to get to this kind of onboarding process that's unified, that's aligned with the needs, behavior, and value of a particular segment, and that delivers the kind of expected experience that consumers have in mind. Those changes become part of the transformation plan. And then the last thing to consider before we kind of bring the transformation plan together is really the financial impact of this kind of change. And so we work with clients with a tool that we've developed called a value map that maps the flow of value through an organization from the customer's perspective. So what customer activities, what customer characteristics, what customer interactions add value, which subtract value, and at the end of the day, what does that total add up to? And so when we talk about a value map, it's really the economic view of your customer's activities, and it can be looked at an individual level, or it could be aggregated up to the level of a business unit, a division, or a whole organization. And it offers the kinds of capabilities that you see listed on this slide. It's an analytical tool that can really help you understand where an opportunity to create value exists in the organization. It can help understand how individual clients or customers or member segments can be handled in a more value-creating way, so how they can be acquired, how they can be retained, and how they can be grown. And then it's also a great tool from an internal perspective to help with prioritization of different initiatives and different recommendations. And we often use the value map once we've worked with the client to create it. We often use it in all three of these capacities. And what you see here is a quick snapshot of a portion of a value map. And you can see that it has some familiar components to it. You'll see, it looks a bit like a decision tree or an ROI tree that you may have seen or created yourself. And I think when you take a closer look at it, which I would encourage you to do if you have time, you'll see that it's written from a customer's perspective. And so, you see things like the number of groups in a particular division of a particular client. You see the number of subscribers within each of those groups. You'll see the number of members in each of those subscriber households. You'll see, branches for health status and number of claims and, things that drive medical cost. You'll see interaction costs, the cost of, communicating with a group, with a member, et cetera. And all of these are brought together by the value map and illustrate the contribution to value made by an individual member or any aggregation of members, such as a group, that you might want to look at. So all of these pieces, all of these client examples kind of come together in our transformation methodology in a transformation roadmap. And as many of your organizations have experienced, and as you know personally in many cases, this kind of change, once you've made the case for it, like we talked about in the very beginning, this kind of change can take a moderate to long period of time. And long in a public company's perspective has different definitions. Your CFO would probably say a long time is 2 quarters. But we're talking about 2 to 3 years for the kind of transformation that we've described here. And so anytime you have a series of coordinated things that need to take place over that kind of time frame, with the potential significant impact that this kind of transformation has, a clear roadmap that everyone understands, can refer back to, and can use to guide decisions and investments going forward is an absolute must. And so what you see on this client example is a roadmap that we worked with a particular health insurer to create. You can see that it's got about a 4-year time horizon, and the various initiatives are mapped out on this Gantt-style chart. You can see in blue and gray the primary recommendations or the primary initiatives that were derived from the assessment, from the research, from the brand study, from the segmentation, from the segment plans, et cetera. The difference between the blue and gray are a common distinction that we make. There are some things that need to happen, capabilities that need to be built, changes that need to be affected, that affect the whole organization, affect the majority of your customer base. And those in this roadmap are blue. We call those foundational recommendations. They effectively raise the tide and raise all boats on the tide. Those are things that improve customer experience across the board, engage customers more deeply across the board, increase efficiencies of certain processes across the board, et cetera. The things in gray are segment-specific recommendations. When we work with clients through the segmentation process, there's often a fairly dramatic value distribution. Certain types of members, certain segments that are extremely valuable, that are really contributing, the lion's share of a company's bottom line performance. Sometimes they are contributing more than 100% of the company's bottom line performance, meaning that the remaining members or member segments are actually taking away from that bottom line in the aggregate. But regardless, there's often segments that are higher priority than others for strategic reasons, for competitive reasons, for financial reasons, et cetera. And so a lot of times we prioritize segment-specific changes, which are shown here in gray, on that basis. The remaining blocks that are indicated here in red are pilot or proof of concept projects. And we find that in our work with clients, these are sometimes the most valuable immediate next steps that can be taken because they're tangible. They demonstrate to the organization that things are happening and they're happening differently. They result in hard data, so they're very useful at proving out business cases, and sometimes the results will surprise an organization with the kinds of member feedback they get, the kinds of behavior change they're able to affect, and the kinds of impact on medical trend or other important metrics that they're able to affect. So these pilots and proof of concepts, again shown in red, are some of the most exciting immediate next steps that sort of kick off the roadmap and set the stage for some of the more sustainable changes and the investments required for them to sustain that are shown in blue and gray. So with what we've just talked through is, I think, 6 or 7 of the key steps or the key stages in sort of mapping out this roadmap for a consumer-centric transformation. And along the way, as we've done this work over the years, certainly in health insurance, which is what we're all here to talk about, and in many other industries that have kind of encountered this customer-centric urgency at different points in time over the last 2 decades. We've learned a series of lessons, and they're hard to capture in bullet points, and certainly the kind of thing that are the kinds of things that are much better to talk about live rather than in a webinar format. But some of those lessons are highlighted here, and not in a particular order, but the first one is these kinds of transformations are only successful when there's the support at the highest levels of your organization. And one of the things that our clients have demonstrated time and time again is that when there is C-level involvement and C-level support, if not board-level involvement and board-level support, that this kind of change, this kind of strategic redirection for a large organization, with that kind of support, can happen and can happen reliably. And without it, it's very difficult for it to happen successfully. And so one of the things that we encourage our clients to do and sometimes work with them to do is to make the case at the highest levels for the urgency to become a more customer-centric organization and to invest in building trusted relationships with end consumers. The second one here is managing the organizational appetite. A lot of times when the customer-centric light goes on, when that light bulb, flashes, an organization, wants to do it all, do it across the board, and do it as quickly as possible. And as we've all encountered in our business lives and certainly in our private lives, that reaction is not always the best way to proceed. And so one of the things that's important is to help your organization understand how much it can bite off and chew as a first step. Help them focus those efforts in the right places so that you see results and can move on to the second step. And so managing that appetite, managing it down to an appropriate and reasonable and actionable level is another important lesson. Inevitably, there are going to be people who question, this direction. Like I said previously, there are people in your organizations whose job it is to deal with other customer types, and they're going to say, well, why do we need to be more focused on the end consumer? There are going to be folks that just don't like doing things differently, whether you've got a unionized shop or not. You'll hear people who don't want to do their job differently tomorrow than the way they did it today. So that resistance is going to come up, and creating forums where people who don't get it, who don't agree, or who don't want to do it, creating forums where they can talk about why they feel the way they do. Sometimes even creating cases, creating kind of the counter case to this direction. Those are oftentimes very critical steps, because once those people have self-identified, once those issues are on the table, we have found that we and our clients can very successfully address that resistance as long as it's visible and identifiable. Involving the support functions is another critical lesson learned. It's easy to think about customer-facing parts of the organization when you talk about this kind of transformation. It's easy to think about sales and marketing and customer service. We've also talked about product development and some other areas. But don't forget about finance. Don't forget about HR. Don't forget about IT. These were parts of the company, these parts of your organizations. While they may not think they touch the customer, if you map customer interactions, they are usually not more than one step removed from it. And you can oftentimes draw a fairly direct line between a database that a database manager or DBA is responsible for and the customer experience that happens using the data in that database. And once you do that, it's very clear to that individual or to the department as a whole that they play an integral role. And that's an important lesson learned. The next couple, communicating and evaluating the business impact, these are a little bit of motherhood and apple pie, but it's easy to lose sight of the fact that they're critical. And so I would encourage all of you, as you're thinking about this kind of thing, to keep them top of mind, even though they may seem like things that just get addressed along the way. Communicating at all levels of the organization is critical. While a lot of the strategy decisions that we discussed here take place around the executive table or in the executive conference room, leaving out the rest of the organization, leaving them out of that dialogue is just making the challenge harder when it comes time to communicate things and to change directions. And then certainly the business impact and the tool called the value map is a critical component. And engaging your finance team, your CFO, and others in that dialogue about the business impact from day one is the lesson learned. That kind of engagement will make subsequent discussions about investment and expenditures that much easier to have. And then finally, the last one listed here is, a key lesson is that you have got to separate opinion from expertise. All of us have an opinion about healthcare reform. All of us have an opinion about the changes that people are talking about. And those of us that are in the industry, that opinion is probably born out of our expertise. But there are plenty of sources where an opinion is just an opinion. And so, hiring people and selecting business partners that aren't just telling you their opinion, but have been there, have worked with clients or been in a client organization themselves and led teams and led an organization through this kind of change, those are the voices that will help guide you down this path toward a more customer-centric organization. And those are the voices that you should be listening to. So with that, I am going to invite Liz Glogowski back to take the reins, and hopefully we will have an opportunity to spend the remainder of our time doing Q&A.
Yes, well, thank you so much, Mark. Those are some great examples and some great activity, and I hope everyone found them valuable. I thought it was really interesting to really emphasize the fact that customer centricity it's a long-term commitment. It takes such a long time for a company to build its own organizational culture, and that there's a lot that it's going to take that shift toward the consumer that really hasn't been thought of before. So I think some of these examples that clients are struggling with, working on, challenged by, I think can be really helpful for others as well. So before we move on to the Q&A, I do want to remind everyone that this is the last of our healthcare webinar series. But don't worry, there's still plenty of opportunity to stay active about customer centricity within healthcare. As I mentioned earlier, we actually have a PDF white paper download that is available for you to download that provides some more detail about one particular health insurer's customer-centric transformation, some of which was detailed here today. So if you're interested in downloading the white paper version, you can click on the download button. I think it's on the bottom right-hand corner of your screen. Now also, all of our other healthcare webinars are available on demand. If you go to peppersandrogersgroup.com/healthcare, you can download or view any of our previous webinars that we've covered topics such as social media. We've gone into more detail about that trust research that I presented earlier. So there's some more information about the topics that are related to customer centricity in healthcare. So you can just go to that link and download any of those on demand at your convenience. And we're also active in social media. Yesterday we actually just created a LinkedIn group called Consumer-centric Healthcare. So if anyone is interested in keeping up with the community about this topic as it grows in more importance, we definitely invite you to join that group. There's a link to it here, which is a short link, but you can also just go to linkedin.com and look up the group Customer-centric Healthcare and feel free to join. We'd love you to participate, share your insights, share discussions, and just learn from each other about this very, very important topic. You can also follow us on Twitter. At Peppers and Rogers Group is our Twitter handle, and we're also on Facebook on peppersandrogersgroup.com, Facebook/Peppers and Rogers Group. So we've got a number of great questions, so we can get right into those. Excuse me. So first, Mark, you mentioned the importance of branding, and branding actually is something, as you mentioned, is new to a lot of healthcare executive healthcare professionals. So how would you define branding within this industry, or define the brand within this industry?
Sure. And Liz, I think that maybe we could point out there's a number of articles and blog posts and other things about this topic that are available online on some of the sources that you described. Because it has gotten a lot of attention recently. But the definition of a brand, there's sort of textbook definitions that I'm sure many of you are aware of, many of you know and or use on a regular basis. Certainly, there are definitions out there that we all studied. But I think a working definition of a brand that has proven to be valuable to us in our client work is, a brand is really what a member or prospective member thinks about your company or your product when you're not around. And, that to us is, certainly not a textbook definition, but as a working definition, thinking about it that way sort of simplifies some of the complex things that need to be considered in addressing a branding topic. When you ask the question, what's the definition of a brand, you could also think about it as, what level within our organization should branding, kind of live? We could talk about product brands. We could talk about brands for business lines. We could talk about brands for different geographies. Part of that is open to change, and your organization can make a decision to go in a different direction. Part of that is certainly prescribed already for you. Certainly for those of you that are part of the Blue Cross Blue Shield Association, you've got some very clear rules and requirements, do's and don'ts to live with. And so what we think is critical from a brand perspective is, as I've said, I think previously, is what we think is critical is sort of building the brand perspective and the brand itself from the individual member on up. And it's almost taking it from the opposite perspective that you would commonly think about. And that's critical because, as I said, the working definition is a definition that operates at the individual level. Right? It's not, what do 10 million people think about us? It's not trying to identify the common denominator across that. Right? It's what does this particular individual think about us when we're not around? And so that individual customer approach is a different approach to branding. And I encourage you, if you're interested in that topic, to take a look at some of the stuff we've written or give us a call to talk about it. There are academic leaders in this space. There are practical leaders like Peppers and Rogers Group in this space, and there are agency leaders, all of whom think about branding in a different way, and that way is a very customer-centric way.
Great. Well, thank you. So you mentioned the importance of really going down to the individual level, and part of that you covered with our 3D segmentation. Do you have any specific examples of some segment-based actions that improved performance from any of our work, or that you know of?
Sure. Yeah, well, and this is this is something that is probably a bit controversial is not the right word, but it's certainly not an action that all of the organizations represented on the webinar would be willing to take, or certainly even could take, depending on kind of their circumstances. But many times you find in analyzing a member base, many times you find clusters of members that are, for lack of a better term, are really highly unprofitable. And for some of our clients in other industries, we start with a provocative recommendation about those unprofitable customers. That recommendation is to fire them. Now, in health insurance, obviously, that is not always possible, and even when it is possible, it's not always advisable. And so one of the common things that our clients do in reaction to that provocative recommendation is think about ways that while meeting all legal, regulatory, moral, and ethical requirements, thinking about ways that they can create the experience that the most profitable and desirable segments want to have, while not underserving or misserving any segments, right? But really focusing on the attractive ones, the desirable ones, the ones that you hope form the foundation of your business going forward. And in the process of doing that, not wasting resources, again, without underserving, misserving, or doing anything, unethical or inappropriate to those segments that are unprofitable. And so, that's a series of actions. It's a set of analyses, first off, on the back of, the segmentation approach that we talked about. And then it's a series of recommendations that can be taken that align resources, build the experience in a direction that is best aligned with the kind of customers, the kind of members that you want going forward. And in that way, you can affect the same kind of customer-based transition that other industries can affect, and do it within all of the boundaries prescribed for a health insurer.
Great. So we just got another question that I think is important to all industries, and that's really getting upper management, senior management really involved. So can you provide some input on maybe the best way or some best practices in order to sell this idea to the decision makers within a business about why it's so important, especially to build a trustable company and those trusted relationships?
Yeah, sure. It's I think represented on this webinar are organizations of many different types, sizes, sort of legal structures, all sorts of different things. And so it's our experience that an executive team, the president of a division or the CEO of an organization, have just as many differences kind of in what motivates them, what captures their attention, what sparks their passion. But at the end of the day, there's really only a handful of things that are kind of the core concerns, for your business. And, whether that's financial performance and profit level, whether that's financial performance and, meeting, financial projections, or meeting, budgets and other things, whether that's member and customer service, how satisfied they are, how healthy they are, how well you're positioned, with the group for the next cycle, and then finally, whether you're well positioned in your markets to succeed, to compete, with folks that are there today or could be there tomorrow. Those are the primary considerations. And what we often find is, while people's passions at the C-level, may stem from different things, at the end of the day, stewards of our businesses come back to those considerations. And so, what we recommend, and more often than not, what we work together with an organization to do, is to really put the facts behind each of those components, and turn those facts into a compelling story. And that story may have, a different tone, a different ending, those kinds of things based on the personality of the CEO or the president or the board. But the plot really comes back to those main components. And so, when we're working with someone or a group to really cement the vision for a customer-centric organization, we really fall back on those basic business drivers, and we package them differently given the motivations and personalities and passions of leadership teams.
Great. Well, thank you so much, Mark, and thank you all for joining us today. Unfortunately, we're out of time, so any unanswered questions we will address via email directly, so don't worry if you didn't get your question answered. This concludes Laying the Foundation of a Customer-Centric Organization, a Peppers & Rogers Group webinar. And on behalf of the entire team, I want to thank you all for attending, and have a wonderful day.